host, Jennifer Jones. Welcome to Medical Mondays with Dr. O. Today's topic is 10 natural ways to manage sinus and allergy problems with lifestyle medicine physician and rhinology specialist, Dr. Susan Edionwe. Now it's time to hear from our premier, Dr. O.
Welcome to Medical Mondays. We are going to have another amazing evening. So let's stay tuned.
Thank you so much, Dr. O. And thank you, audience, for joining Medical Mondays with Dr. Toyin Opisami, MD, American Academy of HIV Medicine Specialist, for an exciting conversation about our health. Medical Mondays introduces health information, medical facts, and possible solutions as we examine health challenges to enable each one of us to live our best life. Whether providing high-quality care for families and individuals through Gennesaret Medical Center, providing care for vulnerable communities through Global Vision Health Center, or providing medical missions in the U.S. or abroad, Dr. Opisami is committed to changing lives through healthcare wherever she goes, one person, one family, and one community at a time. Medical Mondays provides an opportunity to explore healthcare with one of our nation's leading community health advocates and world-renowned medical missions expert, Dr. O. Audience, if you have any questions as you listen to Dr. O and our Medical Mondays guests, please drop them in the chat box or raise your hand and you will be recognized to ask your questions after the presentation. Now, grab your pens and paper, lean in, and get ready for an enlightening conversation about our health. Dr. O, the floor is yours.
Welcome again. So, without much ado, I'm going to ask Dr. Susan Edionwe to share a screen and educate us on how to control these allergens. If you live in Maryland, especially long enough, they say you will develop allergies. So this is an important evening, and this is true for many other states. And that makes this a very important topic. Thank you for attending. Thank you for coming.
Okay, perfect. I was mute. Thank you. Thank you all for having me. Yeah, so just as Dr. O said, depending on where you live, you can be heavily attacked by allergies. And it's something that, you know, is different from region to region, but also different from country and continent. So for those who are tuning in, hopefully you learned something today about how to manage your allergies where you're at. Just a little bit of emphasis, I am a sinus specialist, so I do a lot, 80% of what I treat is sinus allergy. And then of course, I'm an ear, nose, and throat, so I do all other forms of ENT. I'm also a lifestyle medicine specialist, so I like to look at things from a holistic standpoint, natural standpoint. Lifestyle medicine is really about you all taking your health in your hands and your providers helping you to do that. So that's why I wanted to kind of meld the two areas that I specialize in, lifestyle medicine related, and then sinus and allergy, and talk about what we're talking about today. So without much ado, we'll get into it. It is 10 natural ways to manage your sinus and allergy problems. Let me go ahead and click here. So starting with number one, a lot of times the most natural way you can manage your sinus and allergy issues is just by paying attention and avoiding. So I put these two together because this is really what I do. When you come in to see me, you'll hear a lot of questions that I ask. You know, when do you have these symptoms? Is it day? Is it night? Are you outdoors? Are you indoors? I'm trying to build a pattern and understanding of the world around you. And that really requires you to focus and pay attention to when you're feeling your allergy symptoms. So really quickly, what are allergy and sinus symptoms? That many times people get the two confused. Sinus infections are different than allergies, but they do have a lot of overlapping symptoms. Nasal congestion, runny nose, facial pressure pain, sense of smell changes, watery, itchy eyes, itchy nose, itchy throat. All of those sort of go hand in hand. When you're dealing with sinus issues, a lot of these symptoms go from annoying and bad to just much worse. So when people have sinus infections, rather than annoying nasal congestion, they have a severe nasal congestion where they can barely breathe through their nose. And as opposed to having clear runny nose, they have green and yellow runny nose. So it's on a spectrum, and they do go hand in hand, and not controlling your allergies can lead you to a sinus infection. But again, I emphasize, a lot of times when people come and see me, they're so concerned about, what's irritating my allergies, what's irritating, me and causing all these symptoms, and really just simply walking through, well, what's going on at home and at work and around you. Let's actually take the time and pay attention to your surroundings and your symptoms. We actually come to some realizations together. So that's the first thing you can do. And it's the easiest and most natural thing you can do, is pay attention to, the pattern of your symptoms, because that helps me out and that'll help you out. I'll give an example of this for people that may, not understand what I'm talking about. One of the situations where people often come in and complain is nasal congestion, and that's a sign of allergies or sinus problems. And I will have people that come in and say, most of the day I'm fine, I can breathe well, but it's only at night when I'm in bed. Only at night when I'm in bed that I get congested. And I say, well, okay, so when you go to work, are you congested? No. When you go to the grocery store, to your friend's home, no, I'm fine. It's only when I'm in bed. And so I always thank them, because I say, this is a very important observation you've made. You've paid attention to your surroundings. You found that you're not congested any other time. It's just when you get in bed. And that helps me. Why? Because that kind of a situation, that person is typically allergic to dust. And dust mites live on our bed, in our mattress, on our pillows. And so what you see is this person is being exposed to dust when they lay down in bed. And that's why they're only congested in that situation. But had they not paid attention, we would have been running the gambit trying to figure out what it was. So this is a good example of paying attention. And when you do pay attention, then we can learn to avoid certain things, avoid certain triggers, or in the people's cases where it's dust allergy, putting dust covers and things like that around your pillows and mattresses. So it helps to pay attention. All right, the next thing, number 2, is cleaning the home. When it comes to allergies in particular, and again, as I mentioned, if you don't control your allergies, you run the risk of getting sinus infections. But when it comes to allergies, dust and a lot of the pollens and things that track in from outside settle in our home. So if you are somebody that finds, I tend to have a runny nose, I tend to always be congested, make sure that you're giving that home a good clean, especially for dust, dusting from areas that collect dust, and just being mindful of any surfaces that may be exposed to the elements when you come in and out, etc. Even your clothes. For people who are allergic to dust, again, in particular, we recommend cleaning, with cleaning your sheets and your pillow covers and all these things in hot water to really kill those dust mites. Be careful of what you are using when you are cleaning your home. We usually recommend clean that home, but use natural products, because a lot of the heavy and harsher products, those harsh chemicals can actually worsen allergies. So cleaning the home is very important, and what you clean your home with is very important. And it's a natural way to improve your allergies and prevent sinus infections. So number 3 on our list, a healthy diet. Whenever people come in, a lot of times they really want sort of a quick fix. And sometimes when you say, well, you got to eat healthy and you got to do all these different things, people aren't so excited about it. But our studies show us that this actually does work. So a healthy diet, and in particular a Mediterranean diet, works because when you have a healthy diet, you're getting antioxidants that help fight inflammation. You're getting nutrients, other nutrients and compounds that actually help fight inflammation. And why is that important? It's important because when you have allergy problems or when you have sinus infections, part of that is an inflammation cascade that's happening in your nose and in your sinuses. And so when you're eating things that are high in antioxidants, which fight inflammation, that actually helps bring that inflammatory response down. So we know that a good, healthy diet improves your immune system. Again, when you talk about sinus infections, you want that strong immune system to either prevent the infection or to keep it from getting so severe. So this is why a healthy diet is important. Now, a Mediterranean diet is often recommended, and Mediterranean diets are very heavy on the good stuff. So fruits and vegetables, and I put this nice little pyramid here for you to see, but every day eating fruits and vegetables, legumes, grains, very healthy, more natural grown things, that's very important. In terms of meat, fish is emphasized over chicken and red meat and all those different things. So Mediterranean diets, more fish when you talk about the kind of meat choices. And then when it comes to the processed things, the processed foods, which are bad for our immune system, which do increase inflammation in our body, those things are at the very top of the pyramid. You don't want to eat that much of those, tasty things. We oftentimes tell people, don't deny yourself. It's good to, have a little sweet treat every now and again, but everything in moderation. But we've, again, as I said, we've seen so many studies that show us that if you eat the right things, you either eat to live or you live to eat. And the people who are healthiest, they eat the right things and they eat to live. So they look at their food as conduits for improving their health and getting the right kinds of nutrients they need for their bodies. And that's how they eat. So we already have seen that this works in controlling allergies, and also decreasing sinus infections. So that is number 3. Number 4, drinking water. Again, it seems very, we all take drinking water for granted. You tell people, if you drink more water, this will help your allergies and sinus problems. And many times people are like, okay, that's great, thank you. But why does drinking water actually help your allergies and your sinus issues? So in order to understand that, you have to understand some of the chemical changes that are happening in your body when you have allergies. So when you have allergies, one of the defense mechanisms that your body uses, or the defense mechanisms that your body, uses, it releases a chemical called histamine. Histamine is elevated in people who have allergies and sinus issues a lot of times. Now, histamines, they actually, when they roam in your body, these histamines create a lot of our symptoms, a lot of our runny nose, our congestion. Those come from that histamine response. Now, what does this have to do with drinking water? Well, as it turns out, do you know what else triggers histamines in our body? Being dehydrated. So if you don't drink enough water, you raise that histamine level as well. Now, the people who are the most miserable, their histamine levels are really high. So you have allergies, you're dehydrated. Well, guess what? You're elevating that histamine level, and that's going to make you miserable. More congestion, more runny nose, more of those symptoms. If you simply drink enough water, you can actually bring those histamine levels down. Now, what are some other things that we often use to bring histamine levels down? A lot of our allergy medications, that's what they do. They're antihistamines. So for those who have heard of Benadryl or you've heard of Zyrtec, all of those medications, they're actually trying to do something similar, and that's block the histamine response. But if you were hydrated, you yourself naturally can do that, bring those histamine levels down. And when you bring those histamine levels down, your symptoms get better. So simple drinking water does that. It's a natural antihistamine, so to speak. The other benefit of drinking water is that a lot of times, especially the more congested people get and the more inflamed people get, your secretions can become very thick. The way your sinuses work, draining of the sinuses is very important to get rid of any of the microbes that are causing your infection, and to help you get over any infection or any of that congestion. So if things are stuck and not able to drain, it's like being backed up. Your sinuses are unhappy and things perpetuate, they get worse. But when you are well hydrated, your secretions are thinner, and that actually allows things to drain from your sinuses better. So that's the other benefit of drinking water. Next on our list, so the previous things are things, again, in our lifestyle that we can change. Some of these other things are things that we can add, different innovations and different products that can be added. Sinus rinsing. This is probably, I probably recommend this to almost 85% of my patients. If you're not already on it, I typically tell you to get on it. So sinus rinsing is something that you can do to really improve the health and conditioning of your sinuses and clean out a lot of the allergens and pollens and even just environmental things that get into your nose and create a lot of this irritative responses. A lot of times I tell people, especially if they work in very dusty environments, or if they work in environments where they're exposed to different chemicals or just different things in the air, I tell folks, the minute you come indoors from wherever you've been, it's a good idea to just rinse out all of those particles and pollens and where, the elements essentially from your nose and from your sinuses, so that they don't sit in or on those tissues and start this cascade of inflammation. Sinus rinsing for some people with allergies and sinus issues, this oftentimes is all they need to do. So I've had some patients who they suffered with allergies and sinus problems for a long time. And finally I said, okay, try this. And I had only meant for them to try this as part of an overall treatment plan. But then they come back and tell me, you know what, as long as I rinse my nose, my symptoms are gone. So I tell them, look, we've avoided medication. We don't need it. This is all you need. Now, when you're doing sinus rinsing, you have to understand that it's a saline solution that you're creating. Do not get pure water and rinse your nose with it. That will burn. The reason why you have to create the right concentration of a solution, the saline solutions, because that's what your tissues are used to. So if you're going to buy some of the systems that are out there that come with pre-mixed saline packets, pretty much some salt and things like that you put in water, that's good. There are some recipes if you want to be frugal and make your own concoction. There are some recipes to make the right concentration salty solution. But if you're going to do this, it's a good thing, but do not use pure water. I also recommend, if people are going to do sinus rinses, do not use unclean water. You don't want to use well water. You don't want to use untreated water. I usually tell people, if you have access to bottled water, or if you know your water is sufficiently treated, then you can go ahead and do this. But sinus rinsing, again, it's very simple and it really can take care of a lot of symptoms. Even when you're sick, sometimes just simply rinsing out a lot of the mucus and the infection from your nose helps that infection progress and actually resolve sooner. So if anybody has access to this, if you don't want to do it every day as part of your maintenance, I absolutely recommend you should be rinsing your nose when you have any kind of cold, sinus infection, or when you feel at your worst. Okay. Sinus steaming. I think that's like number 6 on our list. Sinus steaming is something else that I recommend. And for many of you, this is not new. This is a natural thing that I'm sure when, for many of us when we were kids, I remember being younger, and anytime I was congested, my parents would boil some water and there, put my head right over it. So this is not new, but it is very, very good. So what are some of the benefits we know that sinus steaming can do? Well, one, the warm steaming helps to relieve some of the pain and pressure that people feel. 2, the steaming, again, it's warm moisture. It helps to loosen and thin out some of the secretions so that you can actually drain. 3, one of the things that we know about how your sinuses and your nose and your respiratory system moves secretions. It's if you look on a microscope at the different tissues in your nasal passages, in your sinuses, in your airway, they have these little structures, these little hair-like structures called cilia. And the cilia, what they do, mucus sits on top of these little hair-like structures, and these structures actually push mucus along. When you are sick, you need these structures to be working really good to push all that infected mucus out of your sinuses, out of your nasal cavities, and to allow things to drain. So when you do have good ciliary function, you tend to progress along better. Well, the warm moisture from sinus steaming actually improves the function of these cells. So you get better drainage this way. So that is a really good benefit. Now, sinus steaming, you can take it to another level and put different kinds of essential oils in it, and like menthol, for example, and really get some good decongestion from the menthol, as well as relief of pain and better drainage. So you can really take this up a notch, but sinus steaming is something that's very natural. And I always recommend, in particular when you're sick, as with the sinus rinsing, be careful of the sources of water that you use. You do want to be sure that the water you're using for steaming is clean water, because you're going to be inhaling this water. Okay, acupuncture. Acupuncture is something that is very, very ancient in the world of traditional Chinese medicine. And in traditional Chinese medicine, they've been dealing with acupuncture for hundreds of, I want to say thousands of years at this point. Acupuncture is something that in the world of sinus and allergy issues, there's a lot to suggest that this actually may work. So what is acupuncture for people who've not heard of it before? Acupuncture is when you place really tiny, thin needles, as you can see in the picture, into various points on the face or on the body. These points are also called meridian points. So this is a little bit of traditional Chinese medicine here, but they call these meridian points. And they believe that if you place these needles in these areas, you release something called qi. And when somebody has a disease, there's a thought that the qi, or the flow of energy, is for whatever reason backed up, or it's not appropriately flowing in that area. So when you put these needles in these certain spots, then you're helping to release the flow of energy and get better defensive qi to those parts of the face or to the body, because you can do this for the body. All of these little different points correlate with a different either organ or a different system in the body or a different spot on the body where that energy will be released. Now, many people, especially in the traditional world and in the Western medical world, many people say, oh, it's just fluff. However, there have been studies that have actually shown that people do see some benefit with doing acupuncture to treat their sinuses, sinus infections and sinus history, or to treat their allergy symptoms. So there was a study that came out recently in the last 5 years that looked at hundreds of different studies over decades and kind of pulled the information together, and they found that, hey, this may actually work. So for people who especially have access to acupuncture or definitely are in the world of naturopathic medicine, this actually may work. In my experience, I've had patients who swear by this when they are sick, when they are not sick. They like to get their acupuncture and they swear it makes a difference. So it's something that I would say, if you're interested in it, there are studies that support it. So I would definitely take a look at it. Okay, now local honey. Local honey is something that I wanted to put here because it's something that we have told people about for a long time. Now, the research behind it is still inconsistent. We have some research that says, oh, it works. We have some research that says it doesn't work. So what do I mean when I put local honey here? One of the techniques that we use when we're trying to cure people of their allergies is by doing something called immunotherapy. And so immunotherapy is when, and now you have to know what this person's allergic to, but when you know what they're allergic to, let's say somebody's allergic to dust, grass, and trees. When you know what they're allergic to, you create a concoction that has little tiny amounts of the very thing that person's allergic to. And you give it to them through injections. And with time, the body starts to recognize these things and then starts to build a tolerance for it. So if somebody's allergic to grass and you start to give them little amounts of a grass, you expose it to them through these injections, after a few years, their body has become so used to seeing or experiencing grass that they stop reacting to it. So that's the best case scenario when we're using immunotherapy to try and cure people. Now with local honey, what we have here is we have bees that do what? They pollinate. So honey oftentimes contains pollens, tree pollens, pollens from the different plants in the area. And that's why we say local, because a lot of times what you're allergic to is what is around you. So you don't want to be in Texas and get, honey from California, because you're not exposed to the trees in California. What you want is to be exposed to the things that are local to you. So honey that's bought locally has some of the pollens of the different plants that are local to you. And the more you eat it, it's believed that you're doing the same thing as what we do when we give you the shots. You're getting your immune system slowly comfortable with the different kinds of pollens in the area. Now, this is something that we have been telling people to do for a long time. And again, the research is hit or miss. You have some studies that show this works. You have a lot of people that say this worked for me. And then you have some studies that say, well, we don't know if it works or not. So I still do recommend it, because even aside from the allergies, honey has great nutritional value. Honey has a lot of antioxidants. It's very good for you. Now, it is still sweet. So you don't, everything in moderation. You don't want to take too much, but it is still good for you. Probiotics. So this is, I believe, number 9 on our list, probiotics. We are starting to learn more and more about what the body can really do. And one of the things in the last 10 years or so that has become a big conversation is the different kinds of bacteria that exist in our bodies. We used to think, okay, well, they're just there hanging out. But now we learn more and more about the fact that these different bacteria in our body, they actually are communicating with our bodies. And when you have good, healthy bacteria, a good, healthy complement of bacteria in your body, your immune system is better. Your health is overall better. And in the sinuses, we have realized that there's a whole range of bacteria in your sinuses. And the makeup of this range of bacteria in your sinuses is actually very important. If you have one bacteria that tends to overgrow and take over the whole flora, well, guess what? That leads to an infection. So enter probiotics. Probiotics are, and you can get that in pill form, you can get it through yogurt. They're foods or substances that actually give you a lot of that good bacteria back. They replenish your bacterial flora. And we have seen in the last 5 years, there have been a couple of studies that have come out that have shown that people who take certain probiotics actually decrease their sinus infections and improve their allergy control. So we're starting to push this out more and more. Right now, you can only really get it in pill form. There is some investigation in actually getting probiotics in a topical form, meaning you can be able to put it in a sinus rinse and actually rinse your nose with a good complement of bacteria. And some of these studies that are showing that this is, a possibility have actually demonstrated that people are getting rid of their infections and their allergies are getting better. So until that actually comes out, I would still recommend find a good probiotic. Whether you get it in certain foods or you take the easy route and you get it in the form of powders or pills, find a good probiotic and take it every day, because it improves your immune system and it can help your allergies and sinus problems. And then last on our list of natural things that you can use to improve your sinus and allergy problems is essential oils. So again, this is something that is age old. A lot of my patients, they use 1 or 6 of these. So I like to put this here to encourage people, if you are using essential oils, the study shows that it actually does help. Now, again, everything in moderation. And I usually caution people against ingesting essential oils because we don't have a lot of understanding of what happens when you ingest essential oils. I usually recommend them for topical purposes. You can put some of these in your sinus washes or in your sinus steams. A lot of these essential oils, they have antimicrobial, meaning some kind of, they fight infection. They either have antibiotic properties, antifungal properties. Some of these, like the menthol, is really good for congestion and just decongestion and helping with sinus pain. So I am all for essential oils. Just again, be careful with how you use them, but this is a good natural way to try and alleviate some of your sinus and allergy symptoms. And so with that, those are the top 10 things that I typically recommend when people want to go natural and look at different ways to, again, make allergies better and make their sinus issues better. I always recommend, if you do have access to an ear, nose, and throat or to an allergy physician, especially if your symptoms are greater than moderate, go and see us so we can also help and give you some prescription things. Because yes, some people, all of these different sort of mild natural things just don't cut it for them, and they actually need some heavy stuff. And we have that. So that's the one thing I would add to this. Still go see your doctor. But I hope that this has at least educated people on some things they can do now to control their allergies and their sinus problems. And with that, I think I will turn it over back to you.
Wow. Wow. Excellent. Thank you so much. You can stop sharing so we can resume.
Dr. O, can you hear me?
Yes, I can.
Can you hear me now?
I can hear you.
Okay, I could not hear you for a moment. Thank you so much. I already put a message in the chat box, Dr. Susan, but I always allow Dr. O to ask the first question. So Dr. O, what say you?
This was fabulous because allergic rhinitis, allergic sinusitis, allergic conjunctivitis is what we live in, day out, especially in Maryland. And as I said, in many other states. So you talked about immunotherapy, meaning, just challenging the body little by little with whatever one is allergic to. What about food allergies? I noticed that, you didn't say anything about food allergies and immunotherapy, treating the food allergies. Do we have anything at all for that yet?
Yeah, so when it comes to food allergies, one of the things I often tell people to consider, one, going back to paying attention. I think a lot of times, especially with kids, parents tend to be more aware of, oh, when he eats peanuts or when he eats, shrimp. But we as adults, we oftentimes just sort of eat things and we don't even really think about what our body is telling us. And many people don't even realize that you may be allergic to something and it may not necessarily present as, immediate congestion or difficulty breathing. It may just present as your stomach hurts every time you eat it, but all the while you're allergic to it. So I always talk to patients about being aware of, is there anything that you eat that you tend to have a reaction to, regardless of what it is, whether it's your belly hurts or you feel like your nose or your throat starts to itch. And then we talk about food avoidance. There's something that we do called an elimination diet. And again, we do this more in kids because we tend to see parents are more aware with what they're eating and the symptoms they're having. But I often tell people, if you have any suspicion that you are allergic to something that you're eating, do an elimination diet. Eliminate some of the common things that we know, like wheat, eggs, peanuts, those things, and sort of take it out and see how you respond. But then keep a food diary when you're doing that and say, today I ate maybe avocados and I felt a little funny. I'm gonna see if removing this from my diet actually helps. So those are things you can do at home to really see if you have a food allergy. Now, there's also food allergy testing. Now, when you talk about food testing, food allergy testing, you'll see that it's a bit controversial. Some people really believe that it works. There are a lot of like naturopathic physicians and even allergists that will do food allergy testing. They'll do the blood testing. Sometimes you can even do skin testing using certain foods. And then you'll see some people that say, I don't know if that works. I personally do think that it's worth getting tested because I've had some people get tested for a food allergen and it came back wildly positive. So it gives us information. So I always recommend it. But even more so, going back to being attentive, if people are paying attention to what they're eating and how it's making them feel, a lot of times those kinds of patients, they solve the mystery before I do.
Thank you. You know, I do food allergy testing as well as the environmental allergy testing in our settings, and it has changed lives.
Mm-hmm.
Practically changed lives, just knowing what you are allergic to. But recently, they've come up with drops that you can use to desensitize people from their allergens as opposed to the shots. You know, coming to the clinic every week to come get shots for 2-4 years can be tough. Although with trusted patients, I think you can allow them take their shots home to do it at home. But can you comment on that and also on the drops that we now have, even though insurances are not covering them? What do you think?
Yeah, you know, so just shots in general, I am a big believer in shots. I think you've already seen it in your practice. In my practice, I've seen some people who just were slaves to their allergies and their sinus problems. I mean, that became a whole occupation, just managing those symptoms, getting them on a good shot regimen. And mind you, as you said, it's at least, you have to do this for at least 3 to 5 years. And usually we tell folks, you have to use it for at least 1 year to even really know if it's working well. So yes, there's a commitment, but when it works beautifully. So I usually recommend it. Now, not everybody needs it. Some people, again, I like to tell people it's on a spectrum. There are some people who just need to rinse their nose with saline and you never see them again because they're so happy. But then there's some people that we have them on 4 or 5 medications and we're just scratching our head saying, oh, how can we get this person to, to actually do better? So there's allergy shots are really good for that, for some of these moderate to severe people. And so, yes, I like to recommend it when I feel like it'll help. In terms of what you were talking about the doing some of the different things under the tongue, sublingual therapy. Yeah, I really do think that is also helpful. I think it's also easier for people to take it home and self-administer. So it depends on the kind of patient we're dealing with. If you have somebody that, they're very self-motivated, they go by the book and they'll follow everything you say, then I like to start thinking about some of those different options for them.
Thank you so much, Dr. O. Any other questions before we go to our audience? So, Dr. Susan, I have a personal question, and then audience, please, I'm waiting for questions in the chat box. We have a few, but get them in. I've read and been told that cleansing your sinuses with the neti pot causes infections, and then I have other people who live by them for their kids and for themselves. So I want to know, is it a myth that the neti pots clean out the first defense immune system cells and disrupt the protective mucosal layer in our sinuses? Is that true, or should we all press forward with the neti pots?
Yeah, that's not true. We should all press forward as long as you can tolerate it. We know that sinus rinsing actually cleans out a lot of the larger particles in our nose that just, come from the different things that are in the air and the different pollens. A lot of times the people who have some kind of reaction to it, we start to question, and usually people will say, you know, I did that and it hurt, or I did that and I got an infection. Then I usually start to ask them things like, well, what did you put in it? You know, some people that aren't able to tolerate it, they're not actually using it correctly. They're not making the right salty concentration. I've had people who kept getting infected with it. And finally I said, all right, tell me exactly how are you making this thing? They were using tap water. And so I had to tell them, hey, you got to stop with the tap water. You know, and because you can't necessarily vouch for the quality of water that you have access to. So then I told them switch to bottled water. That's safer water. Years ago, maybe, yeah, I think maybe 6 or 7 years ago now, there was a big story that went all over the news. And it was somebody who got a brain infection from doing sinus rinsing. And they got infected with an amoeba of some kind. And that is, you know, my patients came in, they're like, I'm not going to do this. This thing caused a brain infection, and this person ended up having a really bad outcome. Those kinds of microbes and bacteria and amoebas, those come from unclean sources of water. So in that person's case, that person, I believe it's a woman, was using well water. And well water is not, I mean, there are filtration systems you can put in your home there, but well water is generally not considered safe for sinus rinsing. And that is how they contracted that. And that's a very rare situation, but as long as you're using the right water and you're putting the right amount of the salt and everything in it, it's pretty safe. It's even safe enough that we recommend it in kids and even in babies.
Thank you so much, because I've always weighed them out. It worked for us. So thank you for affirming. Another person in our chat asked, one person commented and said they've learned more in 30 minutes about sinuses than they've learned and known all their lives. Thank you. Great job. And so can you please talk a little bit about laryngitis?
Laryngitis. Laryngitis is just a technical term for inflammation of the larynx. So there is a number of things that can cause inflammation of the larynx. So laryngitis is just an umbrella term. Now, you can see people develop a laryngitis when their allergies are not controlled. Why? Because a lot of that drainage, it's irritative, and that drainage drains down the back of their nose, down the back of their throat, onto their larynx. And what does that lead to? That leads to sore throat, that leads to hoarseness, that leads to them constantly going, they have a lot of inflammation there. And so when you talk about laryngitis, you have to look at where is the insult coming from? If it's not something coming down from the sinuses, it may be something coming up. So there's something that I treat probably 80% of my time in clinic, at least 1 or 2 people walk in with this problem. And that's something called silent reflux, otherwise known as laryngopharyngeal reflux disease. Mm-hmm. And they get the same sort of laryngitis symptoms chronically. The hoarseness, all of that. And what's happening is it's not coming down, it's actually coming up. Acid reflux is coming up into their throat and creating all that inflammation. I have people where it's so bad, they start to have, vocal cord nodules and all these different things. And even certain kinds of masses that you can get just from really severe reflux. So that's the story with laryngitis. If you develop it, when you come to us, we're going to try and figure out, okay, is it something that's coming down? Is it something that's coming up? Are you just generally sick? You caught a cold and everything is inflamed? It's a bit of a process to figure it out, but that's sort of, the take on laryngitis. And just to recap, laryngitis symptoms, anything that affects the larynx, typically, like I said, the difficulty swallowing, hoarseness can be there, throat pain, throat discomfort, feeling like something is generally there is what we call globus sensation, and sometimes difficulty swallowing. Those are what you can see when someone has a laryngitis.
Wonderful. We have a little bit more time for one more question before today's show ends. What do you think about allergies and obstructive sleep apnea comorbidities?
If you're somebody that has obstructive sleep apnea, well, already when you have obstructive sleep apnea, particularly at night when you're sleeping, what's happening with obstructive sleep apnea is those folks, their airways, in order for them to breathe, like their trachea, more or less their airway, back of the nose, back of the throat, all that stuff is compressing at night. And so when you talk about feeling comfortable as we breathe, you don't want things that'll add to that obstruction. So somebody who already has obstructive sleep apnea, then they have uncontrolled allergies. You're just adding more fuel to the fire. You're already collapsing when you sleep. Then you're congested now. And then you've got all this drainage. So all that stuff just takes up what little space you have left. So I always find that my obstructive sleep apnea patients are just miserable when their allergies are bothering them and then they have their sleep apnea. So I always tell them, especially for those group of people, you got to stay on top of those allergies because you have no room. You have no room for error. Some of us can get away with a little bit of congestion, but sleep apneics typically cannot.
Thank you so much. Dr. Susan, it has been an absolute pleasure to have you with us today. You've educated us, you've inspired us, you've all given us things that we can have a checklist to say, is the dust okay? Am I drinking enough water to take care of ourselves, our families, and our circles of influence? You have been wonderful, and I'm now going to bring on Dr. O for her medical moment.
Fantastic, amazing presentation. Thank you so much. This was beautiful. I learned so much. And I know that a lot of our audience, maybe everybody in our audience, have learned a lot about allergens. That is very important. Every one of us, in one way or the other, are allergic to one thing or the other, you know? And so this has been phenomenal. We will continue talking about this. It's phenomenal. Thank you so much. Again, I really enjoyed your talk. I appreciate you. God bless you.
Thank you.
Dr. Susan, do you have one closing comment that you want to give to our audience before we end today's show?
I just want to encourage the audience to stay vigilant with your health. This is where medicine is going, is making sure that you take your health and your life in your hands. So just as you all have stepped out to just learn something new about your sinuses, I continue to encourage you to keep doing that. And you know, your health is your wealth, so you know, take it very seriously.
Thank you.
Strong health, strong future. Thank you.
Absolutely. Thank you, Dr. O. Thank you so much, Dr. O, Dr. Susan, and each one of tonight's attendees. We are on the Medical Mondays show, committed to continuing our mission to educate, inspire, and empower you, and give you medical information and more. This includes fitness, nutrition, health, wellness, and everything to boost your lifestyle and increase the joy and peace that you have in your soul. Please share the Medical Mondays link and invite your friends, family, faith-based community, nonprofit organizations, and individuals in your communities to join us. If you have additional questions, please email us at medicalmondaysdro@gmail.com. That's medicalmondaysdro@gmail.com. And last but not least, please be sure to subscribe to our Medical Mondays channel on YouTube, Medical Mondays with Dr. O, and be sure to hit the notification bell on the page. That way you'll be notified for future shows and can join us with one click of a button. And most importantly, as you just heard Dr. O say, strong health, strong future is our mantra. We look forward to our next conversation on Monday at 7 o'clock. This concludes tonight's edition of Medical Mondays. Thank you and good night. Okay, thank you everyone for such an amazing first part of the show. Don't leave, don't leave, don't leave anyone. Our questions and answers are gonna continue, but before we do, I wanna pivot to Dr. O to talk to us about our Medical Mondays VIP and champions. And Dr. O, do we have a winner this week?
This week, we have no winners.
Oh,
I know.
you know what that means, audience? That means that of all of you who join us weekly, we are excited when you can get between a minimum of 10, but 10 to 25 guests so that we can make you a Medical Mondays VIP. What that means is that you win a prize and you get the designation in the future to be invited to events, activities, special treats. And so please do everything you can to get a list of 10 people to be your guest on the next Medical Mondays, and then send Dr. O an email and let her know the names of those 10 guests so that we can give you your credit. And I can tell you, Hannah and AJ have created a dynasty. Dr. Edionwe has been our Medical Mondays champion. He's had more than 25 guests. And so the opportunities there. Dr. O, what do you want to say to the audience?
Well, I encourage everyone to do exactly as Dr. Jones has just said, but I just got a text that an email was sent that we do have a winner. Again, Dr. Ephraim and Hannah Ajay. Again. So we need to have some competition here to get, more people to bring more than 10 participants and start competing with them to win at our Medical Mondays every Monday. And by the way, it's the same link. Speakers are different, topics are different, but it's the same link every Monday.
So Dr. O, that is so fabulous. Hannah and AJ, if everybody can do a double congratulations. Thank Dr. Susan Edionwe for giving us an amazing presentation. I'm gonna allow you to unmute your mics and turn your cameras on so that we can see you, and give a round of applause to Dr. Susan for an exceptional presentation. Dr. Susan, I hope that you can see everyone who turned their cameras on. And then AJ and Hannah, please give us some comments, and why don't you strike up a little competition among our Medical Mondays family. Hannah and AJ, are you there? If everybody could return their mics.
Thank you so much. It is priceless, and it's something very awesome that will go in the long run to benefit each and every one of us. So we want to encourage everyone to bring your friends, bring your family, and bring your co-workers, bring your neighbors. It is something that you cannot pay. Guess what? You don't pay co-pay to hear all this information. So jump on. Let's do it together. God bless you all.
Thank you. That's absolutely beautiful, AJ. We just appreciate the support. You're a part of the Medical Mondays team, and you don't have to do what you do, but that's you being gracious and going above and beyond the call of duty to invite new guests to Medical Mondays every single week. And we appreciate you. I knew you were going to make this a dynasty, and we still have that fabulous dinner at King Street Oyster Bar that I'm waiting for you guys to have. Dr. O, what is today's gift?
Dr. Caprice. I defer to Dr. Caprice.
Dr. Caprice, are you able to join us and share what today's Medical Mondays guest will receive?
Yes, this is Dr. Caprice. It's actually an Amazon gift card for $30.
Oh, beautiful. Yes. Thank you so much, Dr. Caprice. You always bring the absolute best prizes, and we're gonna have to get that celebration plan, Dr. O. I think if you set the date, that Hannah and AJ will really be able to have that celebration.
We are waiting for them to give us the date.
Yeah.
We'll do it.
Wonderful. Thank you, Dr. Caprice, so much. For all of you who are new to Medical Mondays, Dr. Caprice is the wind beneath our wings. And so she's here championing us, keeping us focused, making sure we have prizes and the things that we need for a successful week, and lifting us up in prayer every single day. So thank you so much, Dr. Caprice, for all that you do. Okay, so Dr. O, Dr. Susan, it's time for us to continue our conversation. There were several questions that our audience had in the chat, so I'm just going to go on to the next question. Dr. Susan, are there any benefits to herbal products such as ginger, garlic, lemon, turmeric, etc.?
Myself, yeah. So, there are. Mainly what those things have in common is they're antioxidants. So I often will have my patients, I'll prescribe that to them when I talk about different lifestyle changes I ask them to make. I usually will say, you need to start incorporating a regular antioxidant. I myself, I make certain smoothies that I have regularly that have ginger root in them, the turmeric root in them. So I like to get mine through the natural source. But there's also, if you want powders or pills, there's different formulations. But the antioxidant properties of turmeric, ginger, all those different things cannot be denied. So I usually recommend it. Now, I don't necessarily, because we don't have the research to say definitively that if you take just that, it'll cure things. So I usually recommend it's something to take in conjunction with other things. A lot of times with a lot of these herbal things, the concentration of the very powerful antioxidants and things in them aren't super high. So a lot of times being more consistent with your use of herbal medications or different foods, the longer you use it and the more consistently you use it, that's when you start to see the benefit. But I do recommend it.
Wonderful. What could be responsible for the sinus growing polyps that have to be scraped out through a surgery? What allergic substances does one have to be exposed to have such an extreme condition?
It's not so much about what the person is exposed to, it's about how their immune system responds. And everybody's immune system can respond differently to the very same thing. And so first of all, what are polyps? Polyps, I like to describe them as inflammation gone wild. So the amount of swelling in your mucosa becomes so severe that the tissue actually starts to swell outward and form a polyp. Now, again, it really just depends on that person's immune system. If that person has a very robust immune system, they may not be so prone to making polyps. But then you see some people that have some immune system deficiencies or sensitivities, and so they're more likely to form polyps. There is a condition that we often treat where there's a certain subset of people that their immune system is built a little funny. They have what we call aspirin sensitivity. They're just known to grow polyps left and right, regardless of what we do. In fact, those people, I often tell them when I meet them, you're going to need about 4 or 5 sinus surgeries. Sorry. But that's just an overreaction of their immune system. The other reason why people can grow polyps is if they are negligent with their disease. That's the other time where I see really bad polyps. And I'll see, especially with young people, for some reason, my teenagers and my folks in their 20s, as long as they can wake up and open their eyes, they don't care what else is happening. So, but I'll see some of them come in and they have polyps blocking their entire nasal cavity. And I'm looking at them like, you didn't feel that? But they're like, I'm fine. But because it's, when you start to talk to them, oh, I've been feeling like this since I was little, since 10 years ago, and I just never really thought anything of it. Well, yeah, a chronic infection can last for years. And the longer it sticks around, the more likely you'll see polyps and things like that.
Wonderful. I just saw something that was going to be my next question. So I'm so glad that one of our guests asked. They said they've learned today that a simple nasal wash can ease many allergies, and the long benefit will help with our respiratory system. Now, in view of the evil virus COVID-19, what benefits will one get by continuous usage of the mask, especially when one's work environment is pollen susceptible?
I mean, the mask is, I read someone else had also asked about, what's been coming out in the news is that since we've been wearing masks, a lot of us have not been exposed to certain things. Yeah, that's absolutely correct. a lot of the different viruses, like the common cold and different things that we often share with each other, is passed through respiration. But when you're covering your nose and your mouth, you're actually blocking your exposure to some of these different things. For pollens in particular, and using masks for that reason, I do have people where I will recommend, especially people where that is part of their job. They're, folks that work outdoors and they just can't escape it, or some of my air conditioning people, they're going to work in some of the most dusty parts of the home, right? So I usually tell them, look, you're allergic to these things, time to cover up and then rinse when you get home. So yeah, there's definite benefit there. If you have an occupation where you're going to be exposed to a lot of pollens and things like that, I'd say if you can stomach, people saying, why do you have your mask on? Using it.
That is such great motivation for some of us to keep wearing the mask. Yes, Dr. O.
Before COVID, I used to recommend to my patients who have allergies to wear masks during the spring and summer season when you have, the blossoms. And I used to tell them that it's now in fashion, because you see people wearing masks, don't think they have TB or they have something that is infectious. It's why they're wearing it is because they have allergies, and then COVID hit. So it is helpful, but I'm surprised though that I'm still seeing a lot of allergic rhinitis despite the mask. So it is it's the dust in the house.
Yeah, so some of the things in the home. And I think a lot of people too weren't necessarily, because of the messaging with COVID, many people were told, if you're outside, you don't have to wear a mask, as long as you're keeping your social distance. But if you're, exercising outside or you're being outdoors, then you can take it off. So I had a lot of patients that, yes, they would wear their mask around others or indoors, but when they stepped outside, they would take it off because they said, well, we don't need it outside. So I think there was still some of that exposure happening.
That is so true. I didn't think of that. I actually don't wear masks when I go exercising until I see somebody coming, in the same path. Then I put on my mask to pass them. And even if they were on the other side, then I just walk on the other side and I don't put on my mask. You are absolutely right. So that's why we're still exposed. And that's why we're still seeing these allergies. Please exercise. Don't because of that, no exercise.
Absolutely beautiful. We have one last question. So any of our participants, if you haven't gotten your question in, please get them in. Severe allergies and mouth breathing made worsened by underdeveloped upper jaw. This was a comment from Dr. Edionwe regarding our conversation today. What thoughts do you have about that?
Well, it seems like that's a particular case, but it kind of goes back to what we discussed with the sleep apnea. When you have structural reasons to have difficulty breathing, if you add any other source of congestion, inflammation to your nasal airways and passages on top of that, it's only going to make it worse. So in that person's case, underdeveloped jaw, we tend to see in those groups of people, they have a higher propensity for sleep apnea and different things. So they're already having limitations with their nasal airway breathing. And then you add, more to it. So in those communities of people, sleep apneics, people with other structural respiratory issues, I definitely push control allergies if you have them.
Beautiful, thank you. Are there any other questions, guests, before we let our amazing presenter today go? Well, I have just one more myself. So knowing that we have allergies, one of my sons, when they were little, had severe ear infections, chronic recurring ear infections, almost from birth, from like 3 months on. And his eyes were swollen. He was definitely under a pediatrician's care, but we were very surprised to learn, like now when I go look at all of his baby pictures, he had such swollen little puffy face. And then we did the allergy profiles. My older son, we knew he had allergies, so I just started giving both of them Zyrtec. And then we found out that these ear infections were also attributed or could have been attributed to by the allergies and his allergic reactions. What kinds of things should they be looking at now in their adult life? They don't take allergy medicine every day all the time. But I just always wonder, you know, when they catch a summer cold, if it's something that we could have done to be preventative. And now they're young men, so I want to give them help.
Well, I would say, you know, especially when you have those situations when, you know, with little kids, what's happening there is the allergies are creating inflammation. And little kids, you know, their heads are small, they've got big tonsils, they've got big adenoids, their eustachian tubes are relatively flat. And then the ears and the nose are all connected. So they're a little recipe for disaster. And then as they get older, though, things grow, they make more space. So usually I tell parents, we know that allergies, there's a hormonal aspect to it. So even just by going from a child to an adult, hormonal changes may help. And then we know just by physically getting bigger, that may help. So I tell parents, just because a child may have allergy issues as children, that does not necessarily mean they'll have it as adults. But I always say, stay vigilant. Because, you know, and Dr. O can probably speak to this, one of the things we sometimes see is people who had really bad allergies and sinus problems as children, they grew out of it. And then they, you know, their early adult life, they said, well, I'm fine. This is never a problem I'll have again. But then they come back years later and they're like, well, why is this happening to me? It hasn't happened to me since I was a baby. And we know that allergies can go and come as your body really wants them to. As quick as they left, they can quickly come back. And so I tell people, be vigilant. If you are paying attention, going back to one of the things I said, if you start to see symptoms sort of recurring and being consistent, okay, red flag. Now it's time to start paying attention and maybe pick up the Zyrtec again.
Beautiful.
Can
Thank you.
I ask a quick question?
Absolutely.
And thank you so much. This may be a dark question, my sister. Thank you so much for a great presentation. I just wondered if it's possible to post in the chat room the 10 points that you mentioned, that you discussed thoroughly earlier, you know, especially for those who who came in at a later time. I did invite some people and I kind of invited them late. So, and I know they're on. So is it possible to have that posted?
You know what? They can actually watch the whole thing again, including this segment that was not included in the hard stop on YouTube. So if they go to Medical Mondays, there are so many of them on YouTube. I was shocked. But Medical Mondays with Dr. O is the only one. And they can watch it on YouTube so that they can, you know, really benefit from the whole conversation. Because just knowing the points, I don't know if it will be as helpful, but if you will put it there, that would be great.
Yeah.
I think, you know, watching it also over will provide more help. It'll be more helpful. They'll also be able to hear the questions that they were not privileged to be here to hear and what the answers were, which may answer to their, you know, personal states also.
Thank you, Dr.
Yes, sir.
And thank you so much for inviting guests to join us. Yay, on your way to being a VIP.
How about that?
Thank you so much.
And I just posted them there for
Yeah,
you.
they are. They listed the 10 points. You see that, sir?
All right.
Thank you so much. Are there any other questions?
I just want to appreciate our Nigerian guests. I noticed 3, and there may be more, but the 3 of them are still on. When I actually looked, I don't know if we had some that have left before I looked, but we have our sisters, Kende, Ayodele, Lentina, and Miriam Oguntimei from Nigeria. If you look at the time now in Nigeria, you would appreciate the fact that they are not worrying about time, they just want to be educated. And Lentina is actually based in the US. vacationing now in Nigeria, and she joined us. So thank you all.
It's absolutely wonderful. Do you have another question? I see someone's hand is raised.
Thank you, Ma. I just want to say I'm from Nigeria too.
Oh, wow.
Thank you for the good work.
Welcome. Thank you. Oh, thank you.
How beautiful and awesome. We hope that today's show did not disappoint.
Yes, and can you private chat me your number, please?
There are many Nigerians there, and there are people from
Yes,
Canada as well.
Oh,
And
wow.
the person from Liberia also just logged off. So,
Wow. Dr. Ajagbe, you
So
let,
me too, I'm
don't let us miss and Liberian again.
from
sir.
Nigeria too.
From
no,
Nigeria.
I'm Bello.
Oh,
Yes,
Welcome,
I'm Bello.
welcome.
Dr.
I'm
O.
Bello from
I'm
Nigeria
Bello
here.
from Nigeria. That's my wife.
Oh, welcome.
and
Yeah,
Ma.
that's
So
Jessica's
much.
wife. Yeah.
there's Olufomi Fadosin also online from Nigeria.
Welcome. Thank you. I hope you all learned some. I'm sure we did. We all learned that there's lots of allergies in Nigeria. A lot of allergic rhinitis in Nigeria. I've diagnosed so many and have the opportunity to treat so many people. So this has been an awesome session. And I hope you took some things home that we can use to remedy the situation.
Dr. Susan, we are going to be ending the show as we always do. Dr. O always leaves us with a thought and moment. And before we end today, we want to give you the opportunity to do the same. I know that you gave us your closing thoughts in the wrap show, but for the rest of our audience, we've had some people join us in the last minutes. Do you have any more closing comments, or would you like to share something with us?
No, I just would, again, as I said the first time, encourage people to stay vigilant with your health. A lot of the different things that I see and treat, we're seeing more and more, it's our lifestyle. It's the things we're doing and the vices we have and the food we're eating and the fact that we're not sleeping. So I encourage everybody, the fact that you're even tuning in means you care about your health, which is amazing, and continue to get that education. As somebody said, there's no copay, so this is awesome. And anything I can do to contribute to your guys' learning is my pleasure. So thank you for having me. Thank you, Dr. O. Thank you, Ms. Jones. I really appreciate today.
You are very welcome. Dr. O?
Thank you so much. Thank you for readily accepting to come educate us. Again, you've been phenomenal. And I just want to encourage all of us to do the needful and take care of our health. I don't know if you noticed, food is again important. There is no session we have had, it doesn't matter what topic. Food is important. So we need to pay attention. We need to stop eating the high fructose stuff. We need to go to the Mediterranean diet and look at that pyramid. Go to YouTube, go look at it again and see how you can modify your food for better living. The way we eat directly impacts our health. So I'm so excited that we can actually make changes to our own health if we take it seriously and we're willing to do that. Thank you again for coming.
Thank you so much, Dr. O. Thank you so much, Dr. Susan. And we are going to drop in the chat box your contact information, Dr. Susan, if it's easy for you, please share your contact information so that our audience can find you and look for you when we need help. We are so not only impressed by you, but just love your energy and youthfulness and your contribution to tonight's information. Thank you so much. And if you would stay with us as we all commune together and close the show that we always do with smile.
And just before we go there, I wanted to appreciate Dr. Ajibade, Dr. David Ajibade, for introducing Dr. Susan Edionwe. Thank you.
Thank you.